Okay, Declan, so thank you for sitting down with me. For those that don't know your injury history and your story, can you kind of just walk me through what the different types of things that you were dealing with before you first entered the program?
Yeah, so primarily it's just been a lot of arm pain. I'm a senior in college right now, so at the end of my freshman season, my arm started dealing. I started dealing with some arm pain, and that led all the way through to my sophomore year. I got my first elbow surgery. My spring of my sophomore year, I had to get bone spurs removed, rehab from that. Came back and pitched in the fall of my junior year. I was pitching well, and then my UCL popped in the fall of my junior year, and I had Tommy John and basically rehab from that, and then just still dealt with periods of arm pain. I'd go through like 2 weeks of like all feeling good, and then just a lot of pain. Just kept doing that, and just was super frustrating. And besides that, I've been dealing with back and knee pain for the past probably like 3 4 years as well, just on and off.
So for the back and the knee pain, were those
Mhm.
things that you were also trying to address when you wanted to do posture therapy? Was your arm the primary concern of everything?
The arm was definitely the primary concern, but the back and knee, primarily the knee, the back has was got a bit better, but the arm was the big one for sure. But the knee, like I hadn't been able to lunge, I haven't been able to squat, any of that stuff since about my sophomore year, and so those are big things that I really wanted to address as well.
When you started doing these exercises, how long did it start to take for you to feel some results? And
Mm.
did the results happen in your arm first or more of the knee and the low back?
It probably took about, I want to say like 2 to 3 weeks, and the arm started feeling a lot better. It was around, I want to say, probably the 5 or so week mark where my arm was like, oh, this is actually feeling really good. I can throw high intent, almost back to back days a week. But it was so I started noticing around 2 3 weeks, but then 5 weeks, definitely the arm is feeling a lot better. And the knee kind of just over time during doing stuff just felt like gradually felt better and better. And then up until like a week or two ago, I tried to lunge and it was like, hey, this feels pretty good. Been able to get back up to 315 on the reverse lunge. So that was kind of more of a gradual thing. It's like, oh, this feels pretty good.
Do you feel like posture changed more of your ability to go out on the field and compete because like your body felt good and you felt confident in it? Or do you felt like it changed more of like the off-field activities, like the weight room and the recovery aspect more?
Mhm. I want to say both. It definitely helped. It was super easy to implement in my routine, both either before throwing, even before a lift, after a lift, whatever. It didn't take long. It was super easy to implement into my lifts recovery already. But just going out onto the field as well. I mean, my first three, maybe four outings this year, it in the bullpen right before the game, it felt like, oh crap, like this. I hope this doesn't pop again. And that's just like mentally, it's hard to go out and try to just go battle and go compete when you have that in the back of your head. So definitely, I think that ability to like trust it, say like, all right, we're good. We know the arm's not going to break. We know we're feeling good. Now we can just go worry about getting guys out.
What types of rehab or other things did you try for not only the arm, but like also the low back and the knee? Like what are these different types of things that you've tried to rehab with?
Tried a lot of things. Overall, strengthening everything around it. Um, Dry needling, which helps it from time to time, but um, cupping, all that stuff, like the typical avenues, I would say, just things that, and some things that like work, but they wouldn't work for long periods of time. The knee was a bothersome one because that one I tried everything, found like there was nothing structurally wrong with it. That one was did all the typical hips, adductor stuff. I guess even hamstring, like everything, nothing was really seeing a ton of results for the knee and the arm, just use the typical TJ rehab stuff, strengthening everything around it. Um, all the pretty normal avenues, and it was better, but not like the results that I really wanted to see.
It wasn't fixed. Like you could kind of mitigate
Yeah,
it, but it wasn't like
yeah.
100% to that
Or
point.
I'd get it fixed for it would be like, oh, this feels good for a few weeks, and then oh, we had another setback, and then that took, and it was almost like being almost back to square one, and that took like 4 or 5 weeks to get back from that, and it was just a rough process there.
So talking about these different things and the kind of improvements that you felt from starting to do posture is Do you attribute that to like any one particular thing, or how would you kind of describe this process to somebody that doesn't know anything about it?
I would say it is interesting because I didn't know a lot about it to start. I just, but almost just, I just gotta trust the process with it. Like a lot of the exercises will feel pretty weird at the start, or it's like, oh, why am I doing this? This feels weird. But like after about a couple weeks, I noticed some results, and then just like, oh, I kept doing this. I'm starting to see results, and I'm going to keep doing it, making sure doing it twice a day, and then just got better and better.
So how would you describe the process and how I worked with you versus some of like
Yeah.
the other kind of more traditional things that you've tried in the past?
Mm. I think it was a super like efficient process. We'd hop on a Zoom call every 2 weeks. I'd send in the posture assessments. We'd go over that. We'd see what were the improvements of the previous 2 weeks. We'd find things from the previous, like I guess, 2 weeks cycle, find things that we liked, anything we wanted to keep, and then things that we need to address in the next process. We'd go over the exercises on the Zoom calls. I'd send in the videos for the 2 weeks, get the feedback. So I think it was a super efficient process and was super helpful.
How would you describe understanding like that posture assessment? Do you feel like having an idea of the changes that were occurring within your body and seeing it visually allowed you to like also kind of get some clarity with how your body is feeling and like, no, this isn't just like a sense of false hope? Or how did that kind
Yeah.
of go for you?
Yeah. I would say definitely seeing the posture, like seeing the changes throughout like every 2 weeks, seeing it from either it was like week 1 or 2, or when my either my shoulder would be caving in, or I'd have the anterior pelvic tilt, or certain things, or like my knee would be like going inwards. Seeing those changes either from like week 2 to like week 6 or week 8, just seeing the like consistent improvement with it definitely was like, oh, we are getting better, and then feeling the results too, feeling better with my body, feeling better in certain exercises and movements. It definitely just helped reinforce the fact that, hey, this is working, just sticking with this.
So we never directly kind of talked about mechanics. I mean, we did a little bit, but it wasn't like I tried to
Mm.
directly change your mechanics. So how do you feel like your body and the delivery that you have changed over the course of these kind of 3 months?
I felt just a lot more comfortable with it. It wasn't trying to force any certain positions, wasn't trying to sit deeper in my back leg, get arm full. I just able to feel like as the season went on, as we kept doing this posture therapy, and I was able to just go out and actually throw. It felt so much more like natural, and I can just go and rip it.
How do you feel like, and this might be a really hard question for you to answer, but how do you
Yeah.
feel like your collegiate career would have gone differently had you found posture therapy before the initial arm injuries?
Truthfully, I'm not sure. I think we would have been in a good spot. I know at least if I found it last year in terms of the knee pain, I know like that would have been maybe some things would have happened differently, able to lunge properly, get into better positions. Um almost felt like after the initial like tear, like the partial tear I had my freshman year, I almost felt like it was a matter of time. It was just certain doctors wouldn't do the surgery because the tear wasn't big enough. But I think I would have been able to play through, probably definitely play through it a lot more. Might have happened later on, where I probably would have been able to get back a lot sooner
Okay.
if I discovered posture therapy earlier.
So if there was somebody on the fence who was like, hey, kind of like you, I don't really understand a whole lot about how this process works, but I
Mm.
need something to help me get back on the field, what would you kind of say to that person?
I would tell them like just to do it because I was in a spot I think in February when we started working, where I was like, shoot, the season's about to start. We've done everything I can. I've been working my ass off trying to get back. And it's just still having pain, still not seeing the results. It was almost exactly like you said, like I need something. I don't know. And I was like, you know what, screw it, let's do it. And then I don't regret it at all. I'm super thrilled with the decision I made. So I would just say, just go do it.
So post collegiate career, I know we talked a little bit about this on our call last week,
Mhm.
but what I know like you're kind of moving on, but how are you gonna stay a part of baseball? Because I know like obviously it's a very important thing within your life.
Yeah. I'm working in a baseball facility doing like video editing, content creation. So just working with a ton of pro, college, and really good high school guys. I'm gonna keep throwing the facility with myself, trying to see just how hard I can throw, how like trying to push the body to the limits. And obviously, I'm going to maintain posture therapy, keeping my arm feeling good, my back feeling good, my knee feeling good. So I'm just excited to see where it could take me.
Well, dude, I'm excited to see what you're able to do. I think you're going to be able to do some really cool things.
Thank you, man.
Well, Declan, I appreciate you sitting down with me, dude, and sharing your story. And most importantly, I appreciate the hard work that you've put into this because you did everything that I asked you to do, and we were able to get the result because of the hard work that you were able to put in and commit to.
Yes, sir. Thank you.